Hello, HM. Good evening, Honorable Minister.
Good evening. Thank you for inviting me.
Thank you for joining us. Let me start this way. The health sector cannot be undermined in any economy. Do we have enough doctors in Nigeria? Because the WHO says that the ratio of doctor to the citizens is 1 to 600 people, one doctor to 600 people. Do we have that much or that many? Do we have enough doctors in Nigeria?
No, we do not. Even the developed countries where they are going now do not have enough doctors. That's why they are picking doctors from other countries. There's hardly any country that can say that it has its full complement of physicians for its service. But having said that, the migration of doctors is not unique to Nigeria. Even developed countries like the UK, as I've found out when I had a chat with senior officials there, have complained that they are losing doctors to Australia, New Zealand, and Canada, where the pay is higher. So the mobility of doctors is becoming something of a global phenomenon.
Now, that's understandable, but then we need to also domesticate this issue. How do we ensure that Nigeria doesn't experience as much immigration as we're currently experiencing? What can we do to better motivate our doctors?
That's good. It's a good question, but I'll answer it by saying that, first of all, Nigeria produces 2,000 to 3,000 doctors every year, those who are graduating from this country and those who are returning from training abroad. And we're losing about 1,000 who are immigrating, roughly speaking. So actually, there's a net of doctors, if you do an estimate, that there are doctors who are around who are just not employed because they are not being employed by states. And that's why we cannot reach that ratio, and the states complain they cannot pay the salaries. Now, where we have a problem is the exit of mature doctors, the senior ones who have already not only just studied but have received a lot of experience, yes, in their training here in Nigeria, and they take that experience away with them to Europe. But as for absolute numbers, we have actually quite a good number we are training every year graduating from our universities. And once we, at the public hospitals, streamline the processes of employing doctors, we shall be able to refill one for one those who are leaving. But at the same time, we have to have special measures to improve the capacity of those who are filling up the spaces. Because the ones who are leaving are the mature ones, and we need to have people who go up there. Now, having said that, we are trying to do everything we can to improve the conditions of service, to offer bonuses and incentives, and also to appeal to the sense of equity and fairness. That whereas in Europe, doctors who have been trained are bonded to serve their country for a certain amount of years, and those who have been trained at taxpayers' expense. So in Nigeria, those who have also been trained at taxpayers' expense should also know that they owe their country something.
Absolutely. That sounds very understandable. But yet again, HM, I also understand that not only the experienced ones are leaving the country in droves, even the new ones, some of them, a lot of them, are not even waiting to practice at all. Because once they've seen their senior ones leaving in droves, they just finish school and then maybe they work for 1 year or so. And then they just process their papers, write their exams, and off they go. So what are you doing to retain the new ones?
It's not that easy. In reality, they want doctors who have had some experience, because coming out of the university fresh, there is a lot that you still need to learn before they let you handle patients. So in reality, they want those who have had enough training to man, let us say, rural clinics or rural hospitals. So they don't take them straight off the shelf. The process of training, which we embark on in Nigeria, and the training is good, is what we need to accelerate to improve the capacity and fill the gaps that are rising. But we cannot at every rate compete with the salaries that these foreign countries pay, because doctors are paid differently in various countries, and our economy does not allow us to pay what, for example, a doctor in the UK or in America will earn. or a doctor in Australia or New Zealand will probably earns more than the UK. So it varies like that, and doctors all move around to what they call greener pastures. But in the 80s and 90s, I tell you, that's when the real brain movement or brain drain started, when recruitment were going on for Saudi Arabia, the Middle East, Kuwait, and Oman. So it's been going on since the 80s and the 90s. So it's not really in itself a new phenomenon. But on the whole, the balance is that we are producing or getting about 3,000 doctors annually, and we're losing 1,000. So there is a net gain.
Okay, I quite get that as well. Yet again, we also know that, well, maybe we should call them Oliver Twist, because they're asking for higher pay, higher pay. Is there a plan? Is there a plan to increase? And I don't also want us to limit it to doctors, nurses as well. Is there a plan to increase their pay anytime soon? Health workers in Nigeria generally.
Yes, there is a plan, and I will support plans to improve the payment, not only just the salary, but also the allowances they get for the work they do. The president established a health reform committee, and part of what that committee will bring out is how to improve the remuneration for doctors, nurses, and other health workers, so that they can have a better sense of reward for their effort. But also the idea of saying, well, you have been trained by taxpayers' money, so what are you going to give back to the taxpayer? Those questions will arise, and we need to find answers to both sides. But to answer your question, yes, I do support increased remuneration and also increased allowances, and also demand more service from doctors and nurses and health workers.
How soon will this plan to raise their pay materialize?
Well, it's not just something that materializes at once. It will be in stages as we move along. But the bulk of the decision will come from the Health Reform Committee chaired by the Vice President.
Okay, now a minister once said that doctors could go into farming, could go into all kinds of things that not everybody who studied as a doctor, who studied medicine, would practice. And that sounded very ridiculous. So more needs to be done. Do you realize that more needs to be done over and beyond what you've enumerated to boost the confidence of these doctors, and so that they don't feel that their worth is not appreciated?
Yeah, that's perfectly correct. And as a doctor, I share that sentiment. I feel that our work should be appreciated, and we should get the respect for the work we do in society. Well, at the same time, there are doctors who love hobbies. They can have farms by the side. I know some who have farms, who have poultry and so on, but not that they should abandon the medical profession after spending so much on training, on the education. To throw it or to hang it on the wall is not efficient.
HM, let's talk about
beneficial.
Okay, let's talk about HM. Let's talk about the conditions of service. When we go to many of these public hospitals, the conditions are very deplorable. The doctors complain of not having equipment to work. You see that the wards are not really welcoming. They don't look nice enough. You know, you even get scared when you take a patient there, or when you have to visit there yourself. You get scared of not going with one disease and then leaving with another. You know, I think more needs to be done in this regard. What are you planning in this regard before your tenure ends?
Well, thank you. The expression you gave just now, I've heard before from someone saying that you go into hospital with one illness and come out with two. But in reality, what you have said now are largely housekeeping issues. It has nothing to do with quality of the doctors. The nurses, they are well trained. They do their jobs, to a reasonable extent. But we always admonish the medical directors to pay attention to housekeeping. The questions of environmental hygiene, sanitation, water, electricity, and the absolute cleanliness are fundamental to healthcare. So we are putting attention to that. We have set up a standards committee for hospitals, which is chaired by one of our professors. And it is that standards committee that will begin to lay down the rules, including the housekeeping rules that will improve just the ambience in the hospitals and give the patient confidence when they come in. But having said that, I will say that there are some hospitals that actually meet those very high standards. Kano University Hospital, for example, has a very good hygiene and public hygiene and sanitation record. And there are others who are also quite good, who do quite well in making sure that the environment is conducive to patient confidence and to recovery.
Honorable Minister, I must say that you've given a very commendable account of yourself tonight, as far as I'm concerned. But, you know, I'm answerable to the public, to the members of the public. They're going to give me a feedback. If they send me back to you, can you do me a favor? Do you promise that you'll oblige us again and then come back to answer more questions?
Gladly. Our duty is to inform the public. This country belongs to them. And they want to know anything, we are obliged to tell them what we know. We are serving the country.
What's left now tonight is for me to wish you all the best in the rest of your tenure. Thank you very much for joining us on our Primetime News.
Thank you, too. I thank you for inviting me.
You're welcome, Honorable Minister.
Hello. Hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.